Okay.
Say yes to the flu vaccine, vaccination and prevention. Why is resistance to the flu vaccination a problem? Many people think that they can get the flu from getting vaccinated. The loss of time worked by employees as well as lost wages is a serious issue. Healthcare professionals that choose not to get the vaccination are also putting their patients at risk. Statistics show that by receiving the vaccine, the individual will decrease their risk of acquiring the flu. By receiving the vaccine, the healthcare professional can help to protect themselves and their patients from further complications. The most effective way to prevent disease or severe outcomes from the illness is vaccination. Among healthy adults, the vaccine can help prevent 70 to 90% of flu illness. That's said to be by the World Health Organization. What is the flu? Influenza, most commonly known as the flu, is a virus that affects the respiratory system and is highly contagious. It occurs annually in moderate climates worldwide and affects an estimated 5 to 15% of the population throughout the world. It will typically present with fever, muscle aches, headache, chills, fatigue, and cough. It will generally resolve in 7 to 14 days. Are you at high risk? Children under the age of 5, significance increases with children younger than 2 years old. Pregnant women, as well as men and women 65 years and older. People who have medical conditions such as asthma and other chronic lung diseases, brain or spinal cord injuries such as stroke, spina bifida, and multiple sclerosis, diabetes, and kidney, liver, or heart disease.
Hi, I'm Andrea Ramsey. The next part would be, what is a vaccine? A vaccine is a preparation of killed microorganisms, living attenuated organisms, or living fully virulent organisms that is administered to produce and artificially to increase the immunity in a particular disease. It stimulates the production of antibodies in the body that can help fight the virus. Antibodies are produced against the specific strains of the virus contained in the yearly vaccine. The flu vaccine is between 60 to 70% effective in warding off influenza in all age groups combined. That was on the Mayo Clinic website this year. The vaccine is 50 to 60% effective in preventing hospitalization and 80% effective in preventing influenza-related death in the elderly, also from the Mayo Clinic website. Optimal influenza vaccination time is September through December, but may even be given throughout the entire flu season. Types of vaccination and the side effects. There are 2 types of flu vaccines: a flu shot that's made from the dead virus, given with the needle, and the nasal spray that is made from the live weakened flu virus. Regular seasonal flu shot makes up the bulk of the vaccines. There's a high-dose vaccine for people 65 and older, which is an intramuscular injection. And then there's also an intradermal vaccination, which is injected beneath the skin, and it's approved for ages 18 to 64. That was first made in the 2011 to 12 season. Nasal spray vaccines should be utilized by the healthcare workers caring for patients with a severely weakened immune system who require a protected hospital environment. These workers should only get the flu shot. A regular flu shot is approved for most people over the age of 6 months. The intradermal flu shot is injected beneath the skin instead of the muscle with a much smaller needle and is approved for most people 18 to 64 years old. The nasal spray vaccine is approved for healthy people ages 2 to 49 and who are not pregnant. The side effects of the flu vaccine: soreness at the site, redness or swelling where the shot was given, low-grade fever, aches. Side effects of the nasal spray vaccine would be runny nose, headache, sore throat, cough. More serious side effects after the shot would be difficulty breathing, hoarseness, swelling, around the eyes or lips, hives, paleness, weakness, racing heart, dizziness.
Hello, I'm Logan. Can you get the flu from the flu vaccine? No. It is not possible to get the flu from a flu vaccine. The vaccine contains inactivated killed viruses that cannot cause the illness. Our project objectives. Why is the flu vaccine important? The audience to gain the knowledge required to make an informed decision, and empowering our healthcare workers through the knowledge gained. Our results. Get vaccinated. Take the pledge. I pledge to get my flu vaccine in for the year 2013-2014 season. I pledge to get my flu vaccine and take my family to get theirs for the 2013 and 2014 season. I will decline the flu vaccine. This was a sample of our pledge cards used to collect the data. A total of 301 pledges were received, and all agreed to get vaccinated for the 2013 and 2014 season. Our conclusion, through extensive research knowledge was gained and shared regarding the flu and the vaccination. The booth was set up at the Baptist Health in Madisonville, which enabled the group to put the information out there for the staff and the community. Hopefully, staff will feel empowered with the knowledge and make an informed decision regarding getting the vaccination.